Hello and welcome to another Facebook Live broadcast with MedStar Health. My name is Sarah Ridenauer. March is Brain Injury Awareness Month, and we wanted to take some time today to answer your frequently asked questions around the topic of concussions. I'm joined today by three concussion experts. First, we have Dr. Kelly Ryan, board certified family medicine physician who is fellowship trained in sports medicine and is the medical director of our concussion clinic program for MedStar Health. Next, we have Brittany Mafra, a licensed physical therapist who specializes in concussion and vestibular rehabilitation and regional concussion program specialist for MedStar Health Physical Therapy. And last but not least, we have Jenna Page, a certified athletic trainer and community liaison for MedStar Health Sports Medicine. Today, we're going to be answering your frequently asked questions about concussions, otherwise known as mild traumatic brain injury. It's a popular topic amongst athletes and their parents, especially this time of year as spring sports are getting underway. But most concussions are actually the results of falls, so it's important information for all of our followers. If you'd like to know more about concussions, the signs and symptoms, when to go to the emergency room, and what treatments are available, then stick around, share this broadcast with your friends, and ask your questions in the comments below. So, welcome to our panel, and thank you all for joining us. Before we begin our discussion, could you please tell the viewers a little bit about yourself and your professional experience with concussions? I'll start with you, Dr. Ryan.
Oh, thank you so much for having us today. So my name is Kelly Ryan. My original training was in primary care, and then I did specialty training in sports medicine, which is where I learned the most about concussions. But then also once I started taking care of sports medicine and sports related concussions, we started to find a lot of other patients that were having concussions that weren't necessarily related to sports, that didn't necessarily really have like a place to go, or their primary care doctor might not necessarily have been very proficient in taking care of concussions or felt really comfortable doing it. And our ER doctors are just making sure that you're not going to have any life-threatening illness. And while it is a serious injury, it's not necessarily going to kill you. So it kind of left a lot of our patients in limbo. So we've been really working with our concussion clinic at MedStar to try to find a place for all of our concussions, whether they are sports related or whether or not it might be related to being in a car accident, or even just work related injuries, taking care of the whole spread of concussions. And a lot of people would say, well, maybe they should be seeing neurologists. And that's not necessarily the answer either. Trying to get into see neurology is a really long process and can take a while, because there aren't that many in our system, or actually everybody has a difficult time getting in to see neurologists, and they don't necessarily even fit with neurologists. So anyways, that's what our program does, and just making sure that we're available to anybody who has this type of head injury.
Great. Thank you so much. Jenna?
Sure. I've been an athletic trainer for just shy of 19 years now. I spent a long time in Division One athletics, got to see my fair share of injuries at that level. Recently, since moving to MedStar Health, I've been working with a lot of youth sports, and that's where we're going to talk a little bit later on about some of the causes of concussions, but we're spending a lot of time educating people on what they're looking for. Getting your bell rung is much different nowadays than it was back when I was growing up. It means something totally different, and what we need to do to make sure that we're facilitating people to be safe on the field, but continuing to do the things that they like to do.
Yes, great. Thank you. And Brittany?
Hi, my name is Brittany Mafra. I am a physical therapist. I've been doing physical therapy for 8 years now. Originally started kind of in the neuro realm, and got like talked into doing concussion. And once I did, I realized kind of how complex these patients were and how many realms of PT they kind of encompass in terms of treatments. And so they keep me on my toes, and definitely keep me needing to educate, because just like Jenna said, there's so much education coming out now versus what it used to be. And so it's an interesting group to be working with, that's for sure.
Yeah, great. Well, thank you. Let's get into some of our questions. First of all, Dr. Ryan, what is a concussion?
So a concussion is typically most people think of it as like a blow to the head. But not every single blow to the head results in a concussion, and you can actually get a concussion without even hitting your head. Essentially, what happens is if the brain kind of shifts within the skull, it sits in spinal fluid, and it's kind of almost like jello in a fluid, like in a like almost like a jar of water or something like that. So it tends to shift. So when, like for a whiplash injury, right, when you're in a car accident, your head can go forward and then it goes backward and your brain kind of shifts in there. Or like, let's say that we have a lacrosse player and he gets a body blow and falls to the ground. He doesn't necessarily have to hit his head in order to have a concussion. So that's kind of like one of the biggest misconceptions. But essentially what's going on is it's some type of blow that shifts your brain inside of your skull and can cause it ends up being like a very complicated reaction that happens. You won't see it on an MRI, you won't see it on a CT scan, and that's one of the things that makes it so difficult. But there's a lot of processes that happen with concussions, and it makes people feel miserable. But that's more complicated than we have to get into today.
Interesting. Well, that's good to know that it's not just necessarily a hit to the head. I feel like you said, that's people's most common association with concussion. So it's good to know that that's not always the case. And Jenna, what are some of the signs and symptoms of a concussion?
It's interesting, right? So with concussions, it's not something that you can diagnose, like Dr. Ryan said, with imaging or anything else. It's more about what the patient's experience is at that time. So most of the time they get hit in the head and they're complaining about pain, but not just where they got hit in the head. It could be they got hit in the back of the head and the front of their head hurts. Could be that their neck hurts. They're complaining about nausea, dizziness. There's right away, you're going to see kind of a change in the athletes. They'll be shaking their head, they'll be holding their head. You're seeing the signs. That's why, like in professional sports now, they have spotters that are out there looking for those things. It's not like you get a big sign that flashes that says concussion, concussion over top of you. So it's really more about being able to, as the parents and coaches, being able to spot some of the things, like the athletes complaining they just don't feel right. They look like they're slowed down. They look like they're not able to follow the game that's in front of them. They're complaining about all of a sudden being nauseous. They're complaining about that dizziness. It's usually more than just one thing going on with them. And then you can break it down. So when in doubt right there, if you see them get hit in the head or take a big shot to their body and they may have hit their head on the way down, they may have had that whiplash injury, then pull them over to the side, at least do a pulse check on them. Where are we at? How are you feeling? Does your head hurt? If they say, oh, I just got my bell rung a little bit. Well, we need to come on out and let's have a conversation about how you're actually feeling. If they're giving you any of those signs or symptoms right away, when in doubt, sit them out. So go ahead and get them out of play, and then they need to follow up with somebody, sort of keep checking on them, make sure mom and dad know what's going on. So other things that you can observe is they kind of look stunned, dazed. They're forgetting instructions. They're not following cues. They say they can't hear you. They keep messing with their eyes because something visually is going on with them. That's again a time where we pull them out to play and do a little bit more of an interview on the sidelines. I'm not asking people to go out there and go through a SCAT-5 or a SCAT-6 analysis with them like we do as medical professionals, but making sure that you're interviewing to sort of know what's going on with them. We have different buckets that we put some of the signs and symptoms into, whether it's physical, their ability to think, or their cognitive ability at the time. Do they know where they're at? Do they know what time of day it is? Do they have an idea of, able to do the alphabet forwards? That's the first step, especially with some of my youth kids, and then trying to see, can they do the alphabet backwards? Do they know all their months, and can they go forwards with that and go backwards? So it's a lot of quizzing them along the way to figure it out. But a lot of times people will say that they just feel just out of it. They just don't feel right. That's right there a very easy sign and symptom to kind of, again, remove them from play and get them evaluated by somebody.
Yeah.
You know what else is a funny symptom that they always complain about is people say that they feel like foggy, which is not something that most people describes. but it's very unique to concussions. But I think Jenna makes a good point also, is like, never trust a person who has a head injury to respond appropriate, to give you an accurate answer, right? They have a head injury, so at least taking the time to check them out if you think that they had a significant head blow or the potential for a head injury. And sometimes it can take up to 48 to 72 hours after a big hit to actually have symptoms. There's a lot of adrenaline going on, and sometimes we have to wait till that wears down. So people think that you have like immediate symptoms, but it's not always immediate. Sometimes you just got to watch them. And the safest thing is to take them out, because if they were to get hit in the head again, that would be really bad. So when in doubt, sit them out.
Yeah. Well, and I feel like you kind of mentioned, it's good for other people to be able to recognize the symptoms, because I know as an athlete, if it's not a visible injury, I might try to hide it and, not take myself out of the game. So it's important for other people around to be aware and kind of say, hey, come on, like, let's sit you out for a bit, ask some questions, that's all good information to know. And we talked a little bit about this too, earlier, Jenna, but what are some common causes of a concussion, I guess maybe specific to sports or other non-sports related injuries?
So again, talking about the direct versus indirect type of impacts that we have on the body or the head. With football, they're tackling each other. Any tackle could lead to a concussion, right? But that's where the education of the coaches really comes into play. So really looking at any of your contact sports, the collisions, so your hockey, basketball, rugby type athletes, it's collisions. Anytime you have a small projectile that could hit somebody in the head, baseball, lacrosse, field hockey, softball, probably 100 other sports that I'm forgetting to mention right now, but any of that. Improper heading in soccer, it's a bigger ball, so it's less of a direct blow that we're worried about, but it's more that not being prepared or not bracing ourselves the way we need to in order to direct the ball the way we want. Cheerleading and dance, anytime we're doing stunts or lifting, gymnastics, we're flying through the air. There's a chance that you're going to fall. So those falls come back into play there. Really, I think that hits most of the things, but it's just a matter of figuring out and one of the things we see in clinic a lot is the MVA. So when you're in that type of accident, people don't think about it, but that whiplash action really can cause a concussion as well.
We've had a lot of slips on ice too. When people
Yeah.
slip on the ice and they fall and hit their head backwards, falls at work, falls off of things at work, hitting their head on cabinets. A lot of people do that too.
Oh, interesting. So it sounds like a lot. A lot can cause
I
can
think the
cause a
biggest
concussion.
thing would kind of be like those unexpected hits, right? Like
Mm.
because you're not bracing, and the research right now shows that like if you're preparing for the hit, then your head jolts less, right? So that's why like in contact sports, usually those like tackles, when they're expecting it, they're bracing. That's why your NBAs, your slip and falls, or like your unexpected hits are the ones that are likely to most commonly cause those concussions.
Interesting. Yeah, that makes sense.
Yeah, or horseplay in between things, when we're not wearing the proper equipment or the equipment isn't fitting properly for us to protect us. Those are all things that lead to it.
Yeah, good to know. And Dr. Ryan, how is a concussion diagnosed? I know earlier you mentioned it can be tricky to
Oh,
diagnose.
it gets so complicated. I wish that we had I wish that we had a magic way. And there's like a ton of people who are trying to come up with, oh, you can diagnose a concussion with this new fancy tool or this new fancy tool. There is like there's a battery of tests that we use like in our office
Mhm.
to evaluate it. But if you have a really bad head injury, sometimes you may get sent to the emergency department. And the things that we worry about most for people that would make me want to get a CT scan for them would be if they have a really bad head injury and they're vomiting, if they're significantly confused, if they're like slurring, if there's like drooping of their face, if there's weakness of any one specific part of their body, right? So concussions are bad, but like there are things that are much worse than a concussion in terms of head injury that can be much more acute or more dangerous. So we want to make sure that we're not just saying like, oh, this person has a concussion. So if there is significant concerns, again, vomiting is one of those like do not pass go, right? So if you have someone who had a bad head injury and having any of those really bad symptoms, by all means, send them to the emergency department. They will get a CAT scan to make sure that there's not any bleeding. But after that, there's really no test. A lot of times people come in and ask for an MRI, but it's not even going to show us anything. It's really just more based off of our clinical picture. Concussions can be really tricky. I say that concussions are like snowflakes, like they're very similar, but if you look at each individual one, they're a little bit different. The headaches might be a little bit different. Like sometimes their eyes get messed up with concussions. Sometimes their balance is messed up. And there's a number of different tests. We can also talk about their concentration. Some people get super emotional and will cry for no reason. And sometimes that's even one of the main signs or symptoms that might present themselves first is like, gosh, my child is like really emotional after this game. It wasn't that big of a deal. Well, maybe was there a big blow? And look for signs and symptoms later on. But again, so concentration, memory, how their balance is, how their vision is, how their eye movements are, and a couple other tests. We check their neck. And so there's a whole exam that we do, and that's really how we diagnose a concussion. But even just the suspicion of a concussion is really important. A lot of it comes from the history, is kind of how we diagnose it. We wish that there was a better way, but there's not. So that's also really why not everybody in the medical field is up to date with concussions. Concussions have changed. The management has changed a lot over the past like 5 to 10 years, even still. So finding someone who specializes in concussions and getting in to see them early can be really helpful because not everybody's up to date with how to manage and how to diagnose.
Yeah. Interesting. And then what should if someone thinks that they have a concussion or their child has a concussion, what should they do, right after that game or immediately? And is there a certain type of doctor they should go to?
So, at MedStar, we have excellent urgent care centers. If it's after hours and you can't get in to see your regular doctor, initially, okay, we're going to put another plug here. So our athletic trainers are trained medical professionals that often are on the sidelines of our sports. So they are like first contact if you have one. If you are fortunate enough to have an athletic trainer, like start there. They'll give you the information. They'll do an evaluation. Even if they don't necessarily see it, if you think that your child is acting different, you can always say, hey, do you mind taking a look at my daughter or son or whatever? I'm concerned that they're not acting quite right. That's your number one go-to. If you need to, and you don't notice until later on, again, if they're not vomiting, they're not having those really scary symptoms, then if you needed to, you could contact your primary care doctor, or you could take them into one of our MedStar urgent care centers. And then hopefully, if they are diagnosed with a concussion, they can be referred to our concussion clinic, which is where we have providers who are seeing concussions all the time and can do really good in education and information accommodations for school and things like that. We try to get them to be seen by somebody within the first 24 to 72 hours of the initial injury, again, mostly to help with accommodations and education, and then hopefully to at least see one of our specialists within the first week.
Okay. Thanks for explaining that. And Brittany, what sports or activities are athletes more at risk for a concussion? And based on what we said earlier, it kind of sounds like any sport has the risk of it.
Yeah. Contact sports, I feel like as a clinician, I've seen more like soccer. And I think that's because it's a contact sport, but there's no head protection. But I've still gotten our hockey players, our football players, definitely rugby players. But it's important, I think, for people to realize, because they're like, oh, well, hockey players and football players, they have headgear. Headgear wasn't created to prevent concussion. It was created to prevent skull fractures. So you're still at a significant risk to have a concussion. So it's what the research is showing right now is prepare for contact, even if you're not in a contact sport. So figure skaters, right? They're not in a contact sport, but learning how to brace for impact if you're going to fall will help you prevent a concussion down the road. So that's where it's going to be best beneficial, is to like train to prevent versus anything. But definitely, like for males right now, the research is showing hockey and football. For females, it's showing basketball and soccer.
Okay. That's interesting that you pointed out the thing about helmets. I didn't realize that. I immediately figured it was for preventing concussions, but I guess that also makes sense why I know the NFL has introduced those different helmets that I think those are specifically for concussions, correct? To help prevent those. Yeah.
They're getting better at it for sure. They've implemented new rules. I think it's the last 4 years, like
Okay.
off of the kick, there
Hmm.
can't be like an
Yes.
impact,
Yeah.
because that was the leading cause of concussion for football players. Because that player is looking to the sky to catch the ball, right? So they can't see who's going to impact them. Once again, they can't prepare for impact.
Right.
And then that was leading to concussions. So now they've made new rules. So they're trying their best,
Yeah.
and trying to prevent those concussions.
Yeah. Well, I'm going to take a minute and pause for a second. And if you're just now joining us, thank you for tuning in. Today, we're joined by our experts, Dr. Kelly Ryan, Brittany Mafra, and Jenna Page, answering your frequently asked questions about concussions, otherwise known as mild traumatic brain injuries, since March is Brain Injury Awareness Month. Um, it's a popular topic amongst athletes and their parents, especially this time of year with spring sports getting started. But most concussions can be the result of falls, so it's important information for everyone to hear. So if you'd like to learn more, the signs and symptoms, when to go to the emergency room, we have a lot more to talk about. So stick around, share this broadcast with your friends, and if you have any questions for our experts, you can leave those in the comments below. So Brittany, when can someone return to sports after a concussion? Is it kind of patient to patient depending on the severity, or how does that work?
Us, with our athletes, we are obviously in great contact with their provider to make sure, like, are we training to return to sport? So we initially have to like get their symptoms down to a certain level. I can't like be doing exercise with them if they're, usually my gauge is like 6 out of 10. I'm not going to have you do any exercise if you're coming into me 6 out of 10 symptomatic. If I get your symptoms down, then we can start some exercise. But general rule is, as long as you're asymptomatic with all of like your like drills and everything, then we can start some gentle contact or like drills with your athletes like together. And then once they're asymptomatic, full out, still non-contact, then we can start looking back into contact. But we can, as therapists, say like, yes, you're safe to return to sport because you are completely asymptomatic
Mhm.
with all of the activities that are sports related. But me specifically, I like to still coordinate with the physician and say like, hey, this is what I'm seeing. Are we safe? Do you feel like they're safe to return back to sport? But it's also like, what number concussion is this, right? Like, that's a big indication too of if they're safe to return to sport and if they even should return to sport.
Yeah, that's actually perfect segue into my next question for Dr. Ryan. How are multiple concussions dangerous? And I assume yes, they are, but how many is too many?
Well, that is a really loaded question there. Um, and I think Brittany brings up a great point that at MedStar we really try to communicate with our providers and our therapists, and I rely on our therapists and our athletic trainers a lot because I'm only seeing them for maybe like 20 to 30 minutes, right? Every 2 to 3 weeks, depending on how they're doing. And that time schedule can change. But anyways, they're often following up with them more and watching them progress. So, and the other thing is one of the old feelings was like, if you had a concussion, you weren't allowed to do anything. You're
Mhm.
not allowed to be on your phone. You're not allowed to watch television. You're not
Sit in
allowed
a
to
dark
play any
room.
sports. You have to sit in a dark room. Well, I'll tell you what, if you have an AP GT student who plays 3 sports a year and also plays travel and club, and you tell them that they need to sit in a dark room and not do anything, like after 2 to 3 days of that, that can make any symptom worse.
Mhm.
And then you have to start thinking like, our goal is to not keep athletes from exercising. We just want to make sure that we do it safe. And they've actually found that exercise helps to help. It actually helps improve concussions, and it helps in your recovery from concussions. So we don't want to completely cocoon you. The first like 24 to 48 hours, yeah, go ahead, lay low. But just getting them to do some like some gentle exercise, like walking, exercise bike for a little bit, some lightweight, something like that, where they start. So we also don't want them to be deconditioned when they go back, right? So like if they're coming back from a concussion, the last thing you want is for them to be out of shape by the time that they're ready to go back. So we work in a coordinated fashion to make sure that that's appropriate for them to go back. And like I said, it's really nice to work with our colleagues in physical therapy and athletic training to come up with the best and safest plan for our athletes without disturbing their life too much. Because the other problem is like depression is a real thing with our athletes who get concussed. One, if they have underlying anxiety and depression, like the concussion can make it worse, but also keeping them out of their sport makes it worse. So, we want them to be active. We just want them to be safe. So anytime that you go back to a sport, there's always a risk of getting hit in the head again. And that's what we're trying to prevent. We don't want them to go back before they're ready, because if they were to get hit a second time and they're not recover from the first, that's when really bad stuff happens. That's when they get headaches for long periods of time. That's when the dizziness might be worse. And that when you could have like long-term consequences from it. For the most part, concussions get better, and how many are too many? There's not really a good answer for that. Each concussion needs to be managed individually. If you have a patient who's had a concussion and they get better after about 2 weeks and they're back to sport, and then another year later they get another one, but they recover within 2 weeks, and then a couple years later they get another one, is 3 too many? Well, some people used to think that 3 was too many, but as long as they're recovering and they're going back to their baseline and they are not struggling and they're not like from a cognitive standpoint, that they're getting back to where they were in school and they're not struggling, and that like from a physical fitness activity wise, that they're not getting frequent headaches and stuff like that, well then there's not really an answer for that. And it's always like you got to talk to your patients, right? Are sports dangerous? Yes. Are some sports more dangerous than others? Yes. Can you also step off a curve and get injured short? Like you can. So you can't like completely bubble wrap your kids. The other consequence of taking them out of sport is, sport, it's, I mean, as a sports medicine doctor, right? I made a life out of this, but like the camaraderie that they have, exercise is good. We don't want them just hanging out playing video games all the time. Like sometimes their neighborhoods aren't safe. So being in sports programs is the best thing we can do for our kids. So, like, are there risks? Yeah. It's just, we have to talk about them. And then, sometimes if our concussions are taking longer, right? So like if it's taking over a couple weeks, like if it's taking months, if we're going to have to like if we're taking them out of school because they can't even function in school and then they're getting set back that way, then maybe we need to talk about whether or not contact sports are appropriate, even if you just have one.
Yeah.
So it just kind of changes. But I always tell my athletes, like, you have to be like a normal human first, and then you have to be able to be a student, and you have to worry about the rest of your life.
Yeah.
So, but that's pretty rare that we have to have those conversations. There's a couple kids that we have to have those conversations with, but not too frequently, fortunately.
Yeah,
Okay.
Dr. Ryan brings up a good point when she's talking about like you have to be a student. And so when like back to that return to play, like someone could be totally safe to return to play. They've completed their exertion testing, they've completed their sports related tasks and are asymptomatic completely. But when they sit in class, they get a headache. So I'm not going to say, yes, you are. I can tell them, like, from a physical standpoint, you are safe to return to sport. However, we still can't risk it, because if you get hit in the head again, it can ruin your school and take you back even further and make you more symptomatic when you're in school. So there are definitely different things you have to do for every concussion.
Yeah, that's a good point. Yeah, you have to kind of look at it, like you said, from not only just the sports angle, but the everyday life angle and school angle. And yeah, that's important to do, because I feel like especially young athletes can get very focused on just getting better for their sport, and they don't care about school necessarily sometimes. They just want to be able to play. And so yeah, it's important to look out for all angles of that, recovery wise. And Jenna, can you prevent a concussion? I know we kind of talked about earlier, bracing, being able to brace yourself and stuff like that. But how can concussions be prevented, if at all?
Sure. So that's the $1 million question, right? Because if, besides being able to diagnose it quickly, then being able to prevent them from ever happening, right? Even if we wrap them in bubble wrap, like we've talked about a couple times, if they get hit and they're unaware, they're going to have that whiplash mechanism. So there's no surefire way to prevent a concussion from happening. There are ways to mitigate, and there's ways to address some of the big things. So wearing the protective equipment, mouth guards and pads and all that good stuff is great. But if they're still tackling the wrong way, we're in trouble. If they're falling the wrong way, if they're not protecting themselves when they're going down, if they're never following the rules and they're always spearing people, and they're always like, I'm going to take that, 10, 15-yard penalty. I don't care. I'm going to do what I want. That's a problem. So really, for prevention strategies, it's about education, making sure that we're educating people on how to better use their body to decrease in injuries and decrease in those mechanics that cause concussions. Promoting the best technique, whether you're checking in hockey or tackling in football and rugby. Same thing with wrestling, being able to brace yourself and prepare yourself. So some of it comes to your pre-work prior to getting onto the field, your strength and conditioning program or sports performance program that you're utilizing. Shameless plug here, but MedStar Health also has that. We really do have the team approach to take care of your athlete 365 and 360 degrees. But again, avoiding those unnecessarily head impacts. If you see that the catcher's already at the plate and they have the ball, should you go head first? I don't know. It's little things like that, but then along the lines is getting people safely back to play afterwards is the education for the parents, know when to identify, know for coaches, when to maybe move people around as you need to in order to best utilize what you have and getting patients back into play. With that being said, I mean, no, there's no quick way to fix it, but there certainly are a ton of tools out there. They have these Q collars, they have all types of gadgets that are out there, but none of them are going to prevent it 100%.
Yeah, good to know. And Dr. Ron, how long do concussion symptoms last? I assume it's different from person to person and, whether they're getting treated or not. But I guess, can you go over how that differs?
Yeah, that's another difficult
I'm giving you the
question.
tough questions.
Always the tough. Well, actually, that's one again. Brittany had mentioned like one of the reasons that concussions are so interesting is because each one is so different. And so what people think, thank you to the NFL, and think about the NFL though, right? They have like the most resources. They're watching these guys like day by day, like they are motivated to come back. So, that is like best case scenario with all of those resources and all of the motivation to come back, right? So 2 weeks used to be like thing that we used to think would kind of how long people would take to come back from a concussion. But really we're finding that the average, especially for a sports related concussion and like our adolescent populations, is actually going to be closer to 4 weeks. Okay. So even talking to our concussion patients about that and just anticipating that it's going to take a little while and it's not just going to be overnight. It's not just going to be like they see on NFL, like where their fantasy football player will be back by next week and they'll be okay, right? So just telling them like, hey, just be patient. It's going to take a little while, but we're going to get you exercising. We got to make sure that you're safe. Now, some concussions, unfortunately, can take anywhere between like 3 to 6. Sometimes it's not very common that it takes longer than that. We are finding that our older patients actually, and our ones that are in the car accidents, they have a lot more going on. Brittany was mentioning like, the importance of the neck and concussions. If you have a neck injury with the concussion, sometimes the combination can be really challenging. We need a lot of resources. And when you have a person who has concussion, they can only do so much at a time. They can only tolerate so much at a time. So we break up how we're doing things. And so it might take a little bit longer because we don't want to overwhelm them. Sometimes we'll get them into physical therapy. Sometimes we'll get them into speech language pathology, which is like when people are really having a hard time with word finding or like their memory, concentration. Physical therapy helps like when they have balance issues, or if they're having like neck problems. And then also ocular problems, like being able to read, like looking at a line and reading across, can be really challenging for people who have concussions. And our therapist can actually help to retrain your eyes, and help with that. And if that's not helping, sometimes we even have other specialized therapists who are occupational therapists that can help our concussion patients. So we have 3 different divisions of therapy that we can send our patients to. But again, it's just sometimes it can be a process. Sometimes our patients will recover within a couple days. They'll start to feel better. Then we can start the return to play protocol, which ends up being about 5 to 6 days, depending on if you get them in every single day and you can follow them. So it is a process. But yeah, everybody's a little bit different. Sometimes it's 2 weeks, sometimes it's 4 weeks, sometimes it's 2 or 3 months. And maybe 10% of my patients, it might be a little bit longer. And like I said, it all depends on what else is going on at that time.
Yeah. So then that kind of answered my next question a bit too, Brittany,
Oh,
how
I'm
you
sorry. I
no,
took
that's fine.
Brittany's.
I was gonna ask how you treat concussions and how can different types of therapy help. But then also I guess how do you determine which therapies and which treatments is right for each patient?
Yeah. So first, actually, to pile on to what Dr. Ryan said with the like NFL. So there's a chemical cascade that happens with a concussion, and usually for those chemical cascade levels to level out, it takes at least 14 days, and that's for like your quickest healing one. So the fact that like NFL is like 2 weeks and you're good,
Yeah.
well, that's 2 weeks for like your best concussion, and usually now they're saying like you need that full 30 days for that chemical cascade to fully um, dissolve into your system so that you're back to normal. But NFL, but yes, therapy. So usually I do feel like a lot of patients come to PT first. Now I do see like a good amount of like PT and speech therapy. Usually the 3 therapies that treat concussion are PT, OT, and speech. So physical therapy, occupational therapy, and speech therapy. A lot of times you're seeing the speech therapy is helping them with like cognition. So people think, oh, speech, but my speech sounds fine. And it's like, yeah, but you're telling me you're having a lot of forgetfulness, you're having difficulty word finding. That's out of my physical therapy realm. So if they don't already have one, I will ask the doctor, like, hey, is it okay if we get them a speech order? So because of their cognition, but usually they already have one. Then OT, you're looking more at vision. So if a patient comes to me and is like, I'm having some vision issues, usually because it's a lot to have to like see so many therapies. I will say, okay, well, let's just see how your vision does with treating your neck and treating your vestibular system because you're saying you're feeling dizzy, and we'll do a couple of vision tasks. And if it's not getting better with that, then let's add on an additional therapy for occupational therapy. Now, PTs can do vision therapy, but sometimes it's hard to be like, okay, you've got a balance issue, you've got a neck issue, you've got a vestibular issue. Let's fit all, and now you've got a vision issue. So let's fit all 4 things into one session of physical therapy. And it just doesn't really work very well. So sometimes it is very beneficial for them to like fully focus on vision, fully focus on speech. And then with the PT aspect, we can do the vestibular balance and the neck issue. But a lot of times that vision aspect is heavily driven by that cervical spine. So it's good for them to get both because our eyes are so much controlled by our neck muscles. They're so closely related and attached that both of them, if you're getting vision therapy by just OT, you should definitely be getting some PT for your neck too.
Yeah. And then Dr. Ryan, let's say you don't get any treatments, you have a concussion, can they just go away by themselves?
Yeah, sometimes they can. And there are patients who who are young and healthy and they're already making improvement by the time that I see them. And there's plenty of times that I'll just kind of help them by doing some modifications or accommodations, like giving them like a little bit of extra time to do their schoolwork. You know, no testing because I don't want to stress them out too much. And if you do nothing, a lot of times they will just kind of go away. But if they haven't started to improve within like the 2 weeks when I see them for their follow-up, and like depending on what their specific exam is, helps me to determine whether or not they need therapy or whether or not they need any specific treatments or whether or not I think it's just gonna get better. It's just really complicated. Some of this, it's really interesting. One of the questions I always ask my patient is like, is this what you thought a concussion would feel like? Because, right, we hear about it on like television so much, and we do all this education with our teams and or even patients. There's so many patients who have car accidents that have all of the symptoms of a concussion, but just did not think that they had a concussion. Because they didn't hit their head. But so, even though we learn about concussions all the time, it's still very different what patients are actually experiencing. But yes, concussions can sometimes eventually just go away by themselves. But it sometimes it might go away by itself, but that's not going to say that they're not going to have deficits that they don't necessarily even recognize yet. Sometimes people feel perfectly fine and then they'll go back to exercise and they feel miserable. And that's because there's like this blood flow thing that happens, and you have this thing in your system, you have this thing in your body called an autonomic system, and sometimes that can get messed up from a concussion. So when if you have an athlete who's perfectly well conditioned, right, a lot of times their heart responds a certain way to exercise because they're fit. But when you get a concussion, that same patient the next day their heart rate could be all over the place and they might not be able to tolerate exercise. So sometimes, like, just being a normal human, they're fine, but then they try to go back to their sport and then they feel awful again. And that's sometimes also when they need our help or Brittany's help or Jenna's help or, anybody to try to get them back. So can it go away by itself? Yeah, it can. Is it going to be as education is really important. Accommodations is really important. So if nothing else, it's worth going to see somebody for that.
Yeah. And now, Brittany, what is post-concussion syndrome?
Yeah, so post-concussion syndrome is when a concussion lasts greater than 4 weeks is usually when it's called post-concussion syndrome. I know that recent literature is trying to get away from that term and call it prolonged concussion symptoms, so it's still PCS. But after that 30-day mark that I was talking about, your brain essentially is healed, so you no longer have a concussion, but you still have concussion symptoms, and then it's trying to figure out why, right? So this is kind of a long-winded answer, but post-concussion syndrome, there's 5 reasons that you can have this PCS. One reason, like Dr. Ryan mentioned, is blood flow. So if your heart rate isn't regulating properly, then you're going to feel concussion symptoms when doing any form of exercise. And for some people, when they don't get seen early enough, they can go for a walk and get a headache. And so it's really important to be seen as soon as possible, even if you're not sure if you have a concussion, because the sooner you get in, that correlates with a quicker healing time too. The second reason that you can have this PCS is usually like inflammatory because of that cascade, that chemical cascade I've talked about. It's an inflammatory response to your brain knocking around. And if we don't address that inflammatory response, then you just continue to have this inflammation. And sometimes the best way to treat that inflammatory response is just an anti-inflammatory diet, and that'll help take those symptoms away. The third is if your vestibular system was never addressed. So some people, they are like, I've had PT, I've had OT, but I still feel so dizzy. And so if that vestibular component was never fully addressed, that could be why they're still having these symptoms. The fourth is that neck, so that whiplash injury. Sometimes it can very easily be overseen because patients just come in with these raging headaches, and they're like, oh yeah, anytime I look at a screen or focus on school, I have a headache. So then you're like, okay, well then it's vision related. And so there have been times where I've asked a patient, well, did anyone ever work on your neck? And they're like, well, no, my neck doesn't hurt. And I'm like, okay, well, I get that, but headaches generally resonate to a neck issue. So whether it's like upper trap issues or levator issues, like those muscles when they're tight, rather than being like, hey, I'm tight, fix me, I'm going to give you pain here, they're like, I'm going to give you pain here so that you pay attention to me. And then that last component, which Dr. Ryan hopefully would agree with me, this is like our 10% of people that have those concussions for a longer amount of time. There is some kind of psych component. So whether it's underlying depression or underlying anxiety or even PTSD from whatever the event was, right? Like we've gotten people to that are like assaulted. And so sometimes addressing that psychological component is kind of the key that you needed in order to heal those concussion symptoms.
Interesting. Thank you for explaining that. I'd never heard about any type of post-concussion syndromes or anything like that. Um, my last question for you all is just a little wrap-up question. What is one message you'd like our viewers to take away from watching this broadcast? I'll start with you, Dr. Ryan.
Um, Perfect. Thank you. And then I will say, some people actually believe that post-concussion syndrome doesn't start until 3 months later. It's a little bit debatable. And again, just like Brittany was saying, just teasing out exactly like where are these symptoms coming from? You know, what is the main driver? Is it the eyes? Is it the neck? Is it the, you know, the vestibular system or your system that keeps your balance? We will find that patients who have the dizziness component do take a little bit longer than patients who don't have the dizziness component. Just to be aware of that. And you know, I think what Brittany also mentioned about, you know, the psych component also is really important because, and one of the messages that I could take away from this broadcast is like, we're talking about concussions here, just like any other medical diagnosis. Concussions can be really debilitating to people. Like it really messes up their life. If you could imagine feeling sick, like you have the flu and like that foggy feeling and like just the fatigue, barely able to like read one page without getting nauseous or without getting a headache. People can be very irritating and irritable to you because like one of the problems with concussions is that like multitasking is really difficult for them. So they can only do one thing at a time. And a lot of times these are very high functioning people that are used to doing a lot, and it's really a struggle. And the problem with concussions is you don't get any relief from it. Like not even for a couple hours. You know, at least if you have like a knee problem, you can take some ibuprofen and you might feel better for a couple hours at least. But you know, concussions just really are very challenging for patients. And I don't think that, and it's really important for family members to understand how much their family members are going through and to be patient, to be kind to them, to be supportive. You know, when you break a bone or if you had a surgery, right, you have like a cast or you have something that reminds people that you're injured. But when you're talking to them and they're getting overwhelmed, you just forget sometimes because they look normal,
Yeah.
but they don't feel normal. So I guess that'll be my message to everybody is be patient, be kind. Concussions are, it's not really like an injury as much as a syndrome if you ask me. And every concussion is a little bit different, which is why it's important to work with somebody who really can get you that tailored care that's custom to like your specific injury and to get all that good education and information. And you know, again, if you have any concerns about a concussion, don't put yourself at risk for any more head injuries or any dangerous things. The other thing with concussions is it can slow your reaction time. It can make you make poor decisions, concentration's challenging, so driving isn't necessarily very safe. I take care of athletes that are on top of horses and are riding at 40 miles an hour and making split-second decisions. So even if they might feel okay, right, they could potentially put themselves and other people at risk if they're not taking it seriously. So anyways, I think that was like 3 messages in there. So
That was a lot of messages, a lot of good messages though.
sorry.
No, Brittany.
I would say like get checked as early as possible. If you were unsure, it's better to like have gone in and been like, no, actually, it doesn't seem as though you have a concussion. I'd rather like have someone, which is never a waste of time, but I would rather have someone feel like they've wasted my time and be safe versus come to me 3 months later and been like, I just didn't know, because now we're having to work backward. So always get checked early. It's going to be giving you the best outcomes.
Yes. And Jenna?
I mean, the bad news is we can't prevent them. They're hard to diagnose, and everyone is a little bit different. Like the snowflake analogy we talked about earlier. So, I think the big thing is when in doubt, go ahead and sit out from playing and get checked out as soon as possible. I think that goes along with everything we've been talking about so far today.
Yes. Yes, those are all great messages to end on. Thank you for joining us today, to our viewers and to our experts for joining us as well and answering all of our questions. If you want any additional information on concussions or to schedule an appointment, visit our website at medstarhealth.org/concussion clinic, and we'll be posting that link in the comments as well. Thank you again, and we will see you next time.